Good morning to everyone, to Raul, who joins us today, to our sign language interpreter, and above all, to everyone tuned in to this briefing. Today, 1,128 people are hospitalized in Cuba. 31 are under observation. There are 547 suspected cases and 550 confirmed active cases. Yesterday, 4,591 samples were processed in our various molecular biology laboratories. 1,874 were processed at the Pedro Curi Tropical Medicine Institute. 784 in Villa Clara's Hygiene, Epidemiology and Microbiology Center, 287 in Santiago de Cubas, 265 in Havanas, 445 in the Hermanos Almajeras Hospital Laboratory, 201 in the Civil Defense Labs, 201 in the Molecular Immunology Center, 201 in the Manuel Fajardo Hospital Lab, 188 in the Genetic Engineering and Biotechnology Center Lab, and 145 in the Fructuoso Rodriguez Hospital. Of the 4,591 samples processed, 48 tested positive for SARS-CoV-2 and COVID-19. That's 48 people with the virus. This brings the total number of samples processed in the entire country since the pandemic began to 392,785, of which 3,973 people, or 1.01% of all cases, have tested positive for the virus. As I always mention, samples from all of the country's provinces were tested. 122 from Pinar del Rio, 134 from Artemisa, the highest number, 3,151 from Havana, 93 from Mayabeque, 193 from Matanzas, 345 from Villa Clara, 209 from Santiago de Cuba, 96 from Holguín, and so on and so forth from all of the country's provinces, in order to detect all possible COVID-19 cases. All of the 48 positive cases diagnosed yesterday are Cubans. 47 or 98% are confirmed case contacts. This means that 3,526 people, or 90.1% of all diagnosed cases in Cuba, had contact with someone who had previously tested positive for the virus. Of the 48 cases diagnosed yesterday, the source of infection linked to one is yet to be determined. This means that work is still underway to identify the source of infection in 24 cases reported in the last 15 days. Yesterday, none of the people to have tested positive for the virus contracted it abroad, meaning that imported cases remain at 362. Of the 48 diagnosed cases yesterday, 25 are male for 50.4% of all cases, while 23 are female, representing 49.6% of all diagnosed cases on the island. As you can see, similar rates between both sexes. 28 or 58.3% of the 48 cases yesterday were asymptomatic at the time of testing, representing 2,309 people, or 58.1% of all diagnosed cases on the island since the pandemic began. People in this group pose a great risk as they continue to unknowingly spread the virus. That is why, if we don't adequately protect ourselves, we run the risk of contracting the disease. By age group, 3 positive cases diagnosed yesterday are under the age of 18, for a total of 408 children or pediatric cases to have tested positive for the virus in Cuba, 90.4% of which have responded well to treatment and been discharged from hospital. Meanwhile, 22 people diagnosed with the virus yesterday are between 20 and 39 years of age, 14 are between 40 and 59, and 9 are over the age of 60. Of the 48 positive cases yesterday, 39 belong to Havana, 7 to Artemisa, and 1 each to Matanzas and Las Tunas. Regarding the case from Matanzas, the patient is from the municipality of Cárdenas and is a confirmed case contact. Meanwhile, the patient from Las Tunas is from the municipality of the same name and also a confirmed case contact. The 7 cases from Artemisa belong to the municipalities of San Cristóbal with 3, Mariel with 2, and Guanajay and Candelaria with 1 case each. The 39 cases from Havana belong to the municipalities of Arroyo Naranjo with 11, Boyeros with 7, 10 de Octubre 5, Cotoro 4, Habana del Este 3, 2 each from La Lisa, Guanabacoa, and Plaza, and 1 from Playa, Marianao, and Cerro. Yesterday's results by province therefore mean that Havana continues to have the highest confirmed case rate per 100,000 inhabitants over the last 15 days, standing at 23.32, only slightly lower than yesterday's. Artemisa follows with a rate of 10.49, higher than yesterday's figure. Then Pinar del Rio with 5.14. Matanzas rate rises to 3.75. Las Tunas has a rate of 1.50. Ciego de Avila's rate stands at 1.60. And Camagüey with 0.13, similar to yesterday's figure. This means that Cuba has a rate of 5.65 per 100,000 inhabitants over the last 15 days. As you can see, slightly lower than yesterday's rate. To summarize, of the 3,973 people who have been diagnosed with the virus thus far in Cuba, 550, or 13.8%, are active hospitalized cases. 530, or 96.4%, are clinically stable. No deaths were reported in the country yesterday, meaning that Cuba continues to have registered 94 COVID-19 related fatalities since the start of the pandemic. This means that the island has a mortality rate of 2.37%, while the global rate stands at 3.38% and the regional rate at 3.51%. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 54 people, a positive result, were discharged from hospital, higher than the number of those who tested positive for the virus. 38 of those discharged from hospital are from Havana, 9 from Artemisa, 2 each from Villa Clara and Holguín, and 1 each from Las Tunas, Mayabeque, and Santiago de Cuba. This means that, to date, 3,327 people, or 83.8% of all confirmed cases in Cuba, have recovered from the virus. Today, 6 patients continue to be in a critical state, with 14 reported as serious. All of the critical and serious patients are from Havana and are being treated in intensive care. Yesterday, 1 patient passed from serious to critical. 4 passed from serious to closely monitored, while 2 new patients joined the group of those reported as serious. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 286,286 people were diagnosed with the virus, for a total of 24,760,129 confirmed cases since the start of the pandemic. Tomorrow, we're likely to reach 25 million. Yesterday, a high number of people died of the virus around the world, 5,577 to be exact, for a total of 837,579 COVID-19 fatalities and a mortality rate of 3.38%. The region of the Americas accounts for 53.21% of all COVID-19 cases worldwide and reported 137,462 new cases yesterday, for a total of 13,174,448 confirmed cases. A high number of deaths were also reported in the region yesterday, 3,328, bringing the COVID-19 death toll in the Americas to 462,441 and a mortality rate of 3.51%. Just like yesterday, the United States continues to top the list of countries hardest hit by the pandemic, with 5,917,439 confirmed cases and 181,773 COVID-19 fatalities. Next comes Brazil, with 3,804,803 positive cases and 119,000 fatalities. Then India, with 3,463,972 cases and 62,550 deaths. These figures give us an idea of the magnitude of the pandemic and, despite measures, the lack of control that still exists at a global level. The worst affected countries from our region include Peru, Colombia, Mexico, Chile, and Argentina, in that order. That's why our region is considered the epicenter of the pandemic. This is the information we have on the behavior of the pandemic in Cuba and the world.